Knock, knock, can I come in?
Yes.
Hi, my name is Geneviève Ouma. I am a nurse student. I'll be performing the head to toe assessment on you today. Is that okay?
Yes.
First, I'm gonna uh, I'm gonna provide some privacy, wash my hand, and then gather all my equipment here. Okay? Are you comfortable where you're sitting?
Yes.
Okay. Now, I'm just gonna go ahead and access the patient for any misbehavior. The dress is okay, the hygiene is fine, the posture of the patient is good, the patient mood is fine, and then I'm gonna go ahead and access for the level and consciousness. Okay? Can you tell me your name?
Alan.
Alan. Alan, can you tell me what brought you here today?
Yes, I had 5 watery stools today. My diarrhea started 5 days ago. I'm also feeling nauseous for about 2 days, and I vomited twice today. I'm not in pain, I just have discomfort in my belly area, but it comes and goes.
Okay. So can you tell me today date?
October 23rd, 2020.
Do you know where you are?
The hospital.
Do you know the name of the President of the United States?
Donald F. Trump.
Okay, the patient is alert and oriented time 4. Alan, are you in any pain?
No.
Okay, then I'm going to ask you more questions. Alan, do you have any allergy?
Yes, I'm allergic to penicillin.
How about any past surgery?
No past surgeries.
Okay, are you on any medication, Alan?
Not at the moment.
Okay, how about your family? Do you know any disease that your family run to so that you want me to know?
Not that I'm aware of.
How about you? Do you have any past medical issue?
Yes, I have pneumonia. I'm also type 1 diabetes mellitus.
Okay, Alan, are you married?
Yes.
Do you have any children?
No.
Do you drink?
No.
How about the smoke? Do you smoke?
I don't smoke currently. I quit, but I used to smoke 1 pack per day for about 2 years.
Okay, Alan, can you tell me your weight?
130.
Okay, can you tell me your height?
6'5".
6'5". Okay, then I'm gonna go ahead and take the virus sign. Okay, so to start, I will take your pulse. Can you open your finger for me, please, Alan? Here, leave your pulse there. And then while I'm checking for your pulse, can you open your mouth for me for the temperature? Close it. And it's 7.4 and 100% oxygen. And then Alan, I'm going to check your pulse. I'm going to do the radial one for 1 minute. The pulse. The pulse is 78 and the respiration is 18. I was doing that at the same time, okay? So now, Alan, I'm going to go ahead and take your blood pressure, okay? I'm going to use this hand for your blood pressure. Relax. Relax, please. Okay. I'm going to start pumping. Oh, sorry. I'm going to start with this blood pressure one more time. Okay. Because I forgot to put my stethoscope in my. So I'm gonna start one more time the blood pressure. Okay. Wait, let me see this. Okay. Okay. Wow. 119/78. Very good blood pressure in the normal range. Alan, do you have any stress,
No.
any anxiety?
No.
No anxiety. How about your sleep? Do you have a good sleep?
Yes.
Okay, good. I'm gonna go ahead and start now with the assessment, okay? I will start with your head, okay? So, do you have any headache?
No.
Any dizziness?
No.
Okay, I'm expecting for your head configuration. I'm expecting for your head symmetric. And I'm expecting for your scalp. Your head is symmetric. The scalp is not visible. Lesion, nothing. And your hair configuration is fine, okay? So I'm going to go ahead and palpate. I'm palpating for any masses. Your scalp is fine. Your hair is well distributed. There's no mass, there's nothing like that, okay? And then I'm gonna go ahead and palpate for your sinus, okay? Tell me if you have any pain. Let me know. Here, no pain?
No.
Okay, I'm gonna go ahead and palpate your temporomandibular jaw, okay? Which is here. I'm doing that bilaterally. And then I'm gonna palpate for the pulse for 1 minute. This is a temporal pulse, okay? So I'm palpating for a temporal pulse. Everything is good. So your pulse is strong and is present, okay? Now I'm going to access two of your nerves. Cranial nerve 5 and cranial nerve 7, okay? The cranial nerve 5 is just your trigeminal jaw here, okay? Can you push against that? I'm going to see if it's strong. Good, good. Push against. Okay, now I'm going to access your facial, okay? Alan, can you close your eyes for me? Can you open your eyes? Can you raise your eyebrow? Can you squeeze your eyes for me? Can you smile? Yes, can you show me your teeth? Can you pop your teeth for me? Okay, good. Everything is fine. Now, I'm going to go ahead and do your eyes, okay? So for that, I'm going to ask you some questions too, okay? Do you have any problem with your vision? Any pain?
No.
Any pain? No pain. Okay, so I'm going to inspect, okay? Now I'm inspecting for the placement of your eyes. I'm inspecting for the alignment of your eyes. They are symmetric. Your eyebrow is full. Your eyelashes are there, they are full. And then also your sclera. Your sclera is white, which is normal, okay? Now I'm going to access for the cranial nerve 3, 6, and 2, okay? So I'm going to use my pen light for that, okay? So you're just going to follow my pen light. So cranial nerve 3 is just for the constriction for your eyes. Good. That constrict. That is good. Now I'm going to access the cranial nerve 6, which is the movement of your eyes. You just follow this light, okay? How's it? Follow the light. Follow the light. Follow the light. Okay. The eyes are moving without any problem, okay? Now I'm just going to access the perla. The perla is to see how your pupil react to the light, okay? So if I come close like this, your pupil have to constrict. Then come dilate. Okay, so your pupil are round, they are equal. react to the light and accommodation. Okay, now I'm gonna go ahead and then I'm gonna go ahead and do your ears. Okay, so do you have any problem hearing?
No.
Any pain on your ear?
No.
Okay, I'm gonna go ahead and inspect. Okay, I'm inspecting your external ear structures. Okay, the shape of your ear is fine, and I'm inspecting for your external auditory canal. Okay, so it look good. I didn't see any discharge, nothing like that. And then I'm going to access for your gross hearing, okay, just to see if you can hear me. So I will do this. Let me know if you hear. Can you hear me, Alan?
Yeah.
Can you hear me, Alan?
Yeah.
Can you hear me?
Yes.
Okay, so that is, I'm accessing your cranial nerve 8, which is your auditory. Okay, so now I'm going to go down to your nose. Okay, so I'm going to ask you some questions. Do you have any problem smelling? Any problem with your nose?
No.
Any pain in your nose?
No.
Okay, now I'm going to inspect. Okay, I'm inspecting the external nasal structure, which is fine. I'm expecting the nasal passage for obstruction. I didn't see any obstruction. I didn't see any like drainage. I'm expecting for the nasal mucosa. The nasal mucosa is moist and pink. It's very good. Okay, now we're going to go ahead and access your mouth. Okay, so do you have any problem eating?
No.
Any pain?
No.
No pain. Okay, and then any difficulty when you eat? Nothing like that. Okay, good. Now I'm going to inspect. Okay, I'm inspecting your lips to see if they are dry or moist, if there's any sign of that dehydration. Okay, your lips are pink and moist. There's no problem. I'm expecting. Can you show your tongue? Okay, your tongue is good. There's no sign of any like mucosa is fine. Everything is good. I'm expecting for your uvula. The uvula is in the midline. And I'm expecting for the palate. Yes, the palates too are pink, moist, no problem. I'm expecting for the gums, for any bleeding. There's no bleeding. And I'm expecting for the teeth. Can you show me? Do you have, there's no teeth loose, so all the teeth are intact. Okay, so everything is fine. Now I'm going to access the nerve, okay, so I'm going to access the cranial nerve 9, 10, and 12. Okay, so can you swallow for me? Do you have any pain when you swallow?
No.
Can you move your tongue side to side for me? Okay, everything is fine. So now I'm going to go ahead and do the neck. Okay, so for the neck, I'm just going to inspect. Okay, I'm inspecting for the skin color. The skin is normal and appropriate for the ethnicity. Okay, and I'm expecting for any symmetric. The symmetric of is your neck is symmetric. Okay, there is no visible mass. Then I'm expecting for the range of motion of your cervical. Can you cervical spine? Go back. The spine is right straight. There's no pain. Do you have any pain when you're doing this?
No.
No pain, right? And then I'm going to expect for your cranial nerve 11, okay, which is a spinal accessory with shoulder. Okay, so can you against my hand, can you look? Just good. Back. Good. One more time. Okay, I'm going to expect for the trachea. The trachea is in the midline, which is good. Okay, and then now I'm going to palpate. I'm palpating to see if there's any mass. no mass, no lymph node. This is good. Now I'm going to go ahead and access your thorax, which is your lungs, okay? Do you have any problem breathing, Alan?
No.
Are you coughing?
No.
Any spectrum?
No.
What is the last time you have you check your prostate?
A month ago.
A month ago, you check your prostate. Okay, I'm going to inspect, okay, for the skin color. The skin color is normal and appropriate for the ethnicity. I'm going to inspect for the symmetry of the chest movement, okay? The chest movement are normal and symmetric. I'm going to assess for the work of breathing. The work of breathing is fine. There's no sign of difficult breathing. There's no signs of labored breathing. You're breathing fine, right? Now I'm going to inspect for the epidiameter. The epidiameter is 2 to 1, which is good. Now I'm going to go ahead and auscultate, okay? So I'm going to auscultate. What am I auscultating? I'm auscultating the movement of your chest, okay? So every time I will do that, I'll ask you to breathe, okay? You hear me? I'll ask you to breathe. So I'm going to do the anterior one. So I'll start here. Can you breathe? In and out. Good. 2, in and out. Can you breathe in and out? Deep breath. Good. 3, deep breath in and out. 3. 4, deep breath in and out. Good. 5, deep breath in and out. 6, deep breath in and out. 7, deep breath in and out. Good. 8, deep breath in and out. Good job. Now can you turn? I'm going to do your posterior. So it's going to be 10 of them, okay? You're still going to breathe for me in and out. Go ahead. 1. Go ahead. 2. Go ahead. 3. Go ahead. 4. Go ahead. 5. Go ahead. 6. Go ahead. 7. Go ahead. 8. Go ahead. 9. Go ahead. 10. Okay. Good. The chest movement I can feel. There's no. Now we done with the chest, okay, the lungs. Now I'm gonna go ahead and do your heart, okay? So Alan, do you have any chest pain?
No.
Okay, you don't have any chest pain, right?
No.
Any palpitation?
No.
Okay, so I'm gonna go ahead and inspect. I'm expecting to see the skin characteristic, okay? Your skin is normal and for the ethnicity and appropriate. And then I'm gonna go ahead and inspect for the visible pulsation. I didn't see any visible pulsation, okay? Now I will go ahead and palpate the PMI. The PMI is the point of maximum impulse, which is in the third intercostal, okay? So I'll go ahead and palpate. It's here. It's just here. Yes. Top plus. And now I'm gonna go ahead and auscultate. Okay? This time you're not gonna have to breathe. Just normal breathing. Okay? When I did it, then I'm gonna do the normal breathing, okay? For this one. I'm auscultating the pulse, okay? So I'll start here. Normal breathing, okay? I'm gonna auscultate everyone for 1 minute. The aortic one. Okay. Now I'm gonna go to the pulmonic one. And then the same size. I'm doing this for 1 minute. I'm gonna go to the F spine. Then I'll go to the tricuspid pulse for 1 minute. Then I'll go to the mitral one, pulse for 1 minute. Then the last one is the apical pulse for 1 minute. So all pulses are present, they are strong, okay? And they are there, I can feel them. And it's like they are in the normal range, okay? For 1 minute is between 60, so it's almost most of them are between 60 and 80 and 100, which is normal, okay? Now I'm going to go ahead and access your abdomen, okay? So I'm going to ask you some questions. Do you have any diarrhea?
Yep, I had diarrhea, about 5 watery stools today.
Any constipation?
No.
What is the last time you have your BM?
Bowel movement?
Yes.
Was today.
Okay. How is your urine?
It was normal.
Normal. Do you have any problem with your urine?
No.
Do you have a frequent urination in the night?
Yes.
How many times you urine in the night?
At least twice.
Okay. How about the color of your urine?
It was yellow, normal.
Do you notice any blood in your urine?
No.
No blood in your urine. Okay. Now, I'm gonna go ahead and ask you. Okay. So, do you have any diet? What is your diet, Alan? Normal diet. Okay. What is the last time you have your prostate check?
About a month ago.
About a month ago. Okay. Good. Now, I'm gonna want the camera to come over. I'm gonna inspect before you come over. I'm gonna inspect for the skin characteristic, which is normal for the ethnicity. I'm gonna inspect for the skin. Can you turn like this for the light? I'm gonna inspect for the skin characteristics. I'm gonna inspect for the contour of your abdomen. The contour is like round, and I can understand. And because you are a little way a little bit, and then I'm gonna inspect for your symmetry. It's good. I'm gonna inspect for any visible pulsation. Fine. Then I'm gonna inspect for any like the umbilicus. The umbilicus is in the middle and it's fine. Okay. Now I want you to come over with the camera so I can auscultate. Okay. Here. You want to lay down for me, please, Alan? So I'm gonna go ahead and auscultate the 4 quadrant, okay? I'm looking for the bar sound. I'm going to listen the bar sound, okay? So I'll start with the right lower quadrant. Listen for the bar sound. Right upper quadrant. Listening for the bar sound. Left upper quadrant. I'm sorry again. I'm going to listen for the bar sound. Left, right, lower quadrant, right upper quadrant. I'm listening for the bar sound. Left upper quadrant for the bar sound. Left lower quadrant for the bar sound. Okay, the bar sound are present, okay? And then I'm going to go ahead and palpate. Do you have any pain? Because I want to know before I palpate. I'm palpating for any tenderness, any distension, any guarding. There's no tenderness. There's no guarding. There's no distension. Your belly is very soft, which is good, okay? So now you want to sit down for me? Can you come back here? You want to go there with the camera? Come and sit back here, Alan. Here, Alan. I'm going to do the peripheral and vascular, okay? I'm going to ask you some question again, okay? Any numbness, Alan?
No.
Any tingling?
No.
Any pain?
No.
No pain. Okay, good. I'm expecting for the skin characteristic. Your skin is normal for the ethnicity. I'm expecting for any hair, like the hair distribution is fine. The hair is well distributed, is evenly. And then I'm going to expect for any edema. I didn't see any edema anywhere. I didn't see. Then I'm going to inspect for the skin turgor, for any dehydration. So I'm going to pinch it like this and let it go. It goes less than 2 seconds, okay? And then I'm going to look for the capillary refill. So I'm going to pinch here your nails. Let it go. It goes back less than 3 seconds, okay? The other one was less than 2 seconds, okay? Now your nail shape. I'm looking for your nail shape. The shape of your nails is very good, okay? I access your nail shape. And then I'll go ahead now and palpate, okay? I'll palpate for any pulse, okay? I'm going to do that bilaterally, the radial one, for 1 minute. I'm going to do the brachial for 1 minute. And posterior for 1 minute. I'm going to do, can you raise your feet for me? Yes, because I want to do the dorsalis one for 1 minute too. All poses are present and they are strong, okay? Now, I'm going to go ahead now and do the range of motion, okay? So, then, I'm going to go ahead and do the range of motion. Can you come here, Alan? This is going to be the active range of motion. So, I'm just going to tell you what to do and you will do it. Start with your shoulder, your hand, okay? Yeah. So, flexion, extension, flexion. Now, adduction, 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 adduction. Okay, now go to the hips. Can you do abduction, adduction, abduction, adduction, and how about in rotation, out rotation, in rotation, out rotation, and then I'm going to do the knee. Okay, that was the hip. Now do the knee, both at the same time. Flexion, extension, flexion, extension. And then now I'm going to do the leg, okay? The leg. So I'm going to do your hip. So can you do the abduction here too? Adduction, abduction, abduction, adduction. Now I'm going to do this. Dorsiflexion, plantiflexion. Dorsiplantiflexion, dorsiflexion, plantiflexion, dorsiflexion, plantiflexion. Now I'm going to do with the thing, adduction, abduction, adduction, abduction, adduction, abduction, adduction, abduction, adduction, abduction, 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 abduction. Everything is fine. Alan, can you stand up and can you stand up? Can you raise your hand against mine? Do it. Go and push, 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 push. Good, good, Alan. Your muscles are very strong, okay? So thank you so much for letting me do this. And then, are you comfortable where you are?
Yes.
Do you need anything?
Water.
Okay, Alan, this is a water for you. And then I'm going to give you a call light, okay? If you need anything, just let me know. Call and I'll come, okay? Thank you so much. Bye-bye.